Hello and welcome to Keep Talking, a community dialogue about mental health. My name is Gay Maxwell and I am the manager of the Office of Continuing Education at the Brattleboro Retreat. The Brattleboro Retreat is an addictions and mental health care hospital located in southeastern Vermont. It was founded in 1834 and since that time has served adults, adolescents, and children in a variety of inpatient, outpatient, and residential settings. The Brattleboro Retreat provides care and courage when being human hurts. Today in our studio, I am really delighted to have Nnamdi Pole as my guest. Nnamdi Pole is a professor of clinical psychology at Smith College and licensed clinical psychologist with expertise on cultural and biological factors in traumatic stress. Thank you so much for joining us. You're giving your time, and it's really a pleasure to have you on the show.
It's a pleasure to be here, and thank you so much for inviting me.
You are welcome. Some of Dr. Pole's research has focused on post-traumatic stress, even among racial groups and sexual minorities, but also among police officers. He is a former member of the board of directors of the International Society of Traumatic Stress Studies and also founding member of the American Psychological Association's Trauma Division 56. And today, today I invited you on this program because you are going to be part of the Office of Continuing Education's fall series at the Brattleboro Retreat. Dr. Pole will be presenting a conference called Traumatic Stress in Racial and Sexual Minorities on December 2nd of this year. This will be a workshop that is for mental health professionals from all over New England. But I thought it would be great to get you on Keep Talking so we could have a discussion about what's going on currently in the world and to get your take on it. Because I think this is a really important subject for so many people to have a discussion about. It's been a time in history when for all too long in the news and in social media, there have been many stories, too many stories, about and images and names of African American men and women and children who have been killed in police events throughout the United States. Names like Alton Sterling, Philando Castile, Walter Scott, Michael Brown, Sandra Bland, Trevor Rice, Eric Garner, to name a few and to name too many. These have been really horrifying and jarring and upsetting and traumatic events for all of us. So I wanted to invite you to this program to talk about the ramifications and the psychological meanings, of these events for people of color. And perhaps you can help me and you can help the Brattleboro community television audience with a deeper awareness, a greater compassion, the courage to speak up about this chronic and repeated trauma. So I wanted to start our discussion. That's a long-winded introduction.
But it's a great
Pole.
introduction, and I feel like you really have framed the issue well. So thank you.
Well, thanks.
Yeah.
And the reading that I was able to do, I discovered this phrase called label, race-based traumatic stress injury. And I understand that there's several scholars who, including a gentleman by the name of Dr. Walter Smith Jr., they've argued that many African Americans suffer from race-based traumatic stress injuries as a result of experiencing and hearing about these events, and perhaps also because of various social and historical factors. And I wanted to get your take on that, the definition of race-based traumatic stress injury, and whether that's a framework that you see things from.
Yeah. Well, again, great question. I appreciate your effort in doing the background work you've done, and again, there's so many ways to sort of get into this topic. And what occurred to me as you were doing the earlier part of the introduction is the name of the show, Keep Talking. And as you were saying that, one of the first things that occurred to me is that these incidents that you're describing have really, I think, forced the country to start having a dialogue about things that have been hard to talk about, and so I think that that we as Americans, like to view ourselves as a country that is just, morally just. We are aware of all of the ways that we've been a leader in the world in terms of social justice, and yet I think we tend to sometimes minimize some of the racial history that we've had to deal with, and we want to believe that it's very much in the past. And I would say certainly, with the 2008 election of Barack Obama, the first African-American or biracial president, I think there was a wish to have that be sort of a turning point where we would become post-racial and maybe not have to talk about race anymore. But it seems ironically we're having to talk about it even more. So coming back to the question you just asked me about race-based injuries, traumatic stress injury, I think it is, obviously these are painful events, I think, for anybody who's encountering them. And I think if you're somebody who has been personally touched by such an event because someone close to you has had it happen, or in your neighborhood or community, I think it's more obvious to people that would be a kind of traumatic experience to know somebody who's been killed by a police officer in a seemingly unjust way, where maybe they were unarmed or there was some misunderstanding or something like that. But I think the question that you're asking gets to a maybe a more controversial question, which is, is it to what extent do African Americans, maybe someone like me, who identify as African American, and I myself have never witnessed one of these police shootings in person. I've had some encounters with police in my personal life that were, not the most comfortable, but it hasn't affected me personally. So your question's kind of like, to what extent do we think that African Americans in general in society are being traumatized in a sense by these events? And I think that there is some evidence that a person can experience pretty extreme psychological distress and something along the lines that creates psychological symptoms as a result of having these repeated media exposures. And I think that the key to understanding or thinking about the idea of a race-based traumatic stress injury is to recognize that we as humans tend to have lots of different intersecting kind of identities that we sometimes are barely aware of. So for example, you introduced me as a professor of psychology at Smith College. That's one of my identities. A few minutes ago, I mentioned that I'm an African American. Maybe it's obvious to people looking at me that I'm African American. That's another identity. I'm also somebody's brother. I'm somebody's son. I live in Massachusetts. And I've got all these different identities. And so one of the questions I think when we think about a race-based injury is that it's when, in a sense, it's when something happens that feels like an attack on one's racial identity, and when one's racial identity suddenly becomes a marker of potential harm. And I think this is kind of what these police incidents are doing, because race is one of those identities that is a very visible identity, and it's one of the reasons why I think legislators have made a special concern with hate crime. This idea that certain crimes can happen in society that put an entire group at risk simply because they're a member of that group. And if you're somebody who's not an ethnic minority, or you're not somebody who's had an identity that's been targeted, it may be hard to understand, but I think for anyone watching this program, you can think about being an American citizen in the wake of 9/11. So one's American citizenry is another one of those identities, where most of the time we walk around, we sort of take our American citizenry for granted, except for when we hear that terrorists are attacking Americans, and those terrorist attacks can happen any place. They can happen in airports. All of a sudden, your American identity becomes this targeted identity, and you have to feel threat and fear simply because of who you are as an American citizen. And that may not be obvious or as visible as race. So I think when we talk about a race-based traumatic injury, it's where suddenly there's accumulating evidence that people in the world who look like you, carry your sort of facial features, seem to be targeted or at risk of death or injury simply by living. And I think that's what we're talking about. And then what happens to one's psychology as a result of that. So I think I'll sort of leave it there. I mean, I can say a little more about it, but maybe your next question. Follow up and let me say where we should go.
One of the things I think of, if these are happening repeatedly,
yes,
and chronically,
yes.
Is there a relationship between race-based traumatic stress injury and moving into the territory of post-traumatic stress disorder. And maybe we should walk that back a little bit. Maybe just you could define post-traumatic stress disorder for me first, and then and talk about the relationship between those two things.
Right, because that's another element of the first question that you asked. So to what extent, if there is a sort of race-based traumatic stress injury, does it bear any similarity to what we would, a more recognized psychiatric condition that we call post-traumatic stress disorder?
Exactly.
And so one thing to say about just to define it for the viewers, because I know that we have a wide audience in the community, post-traumatic stress disorder is a psychiatric condition that emerges after a person experiences or even witnesses, or sometimes even learns about an event that involves serious injury, death, and sometimes sometimes it's been defined as a threat to physical integrity. So things like sexual assault, where there may not be a death involved or a physical injury, but the fact that it's an invasive, kind of, very an assault on one's bodily integrity, that would count as an event. And so when we talk about these so-called traumatic events, these are events that sort of have those characteristics, and I say it can happen to you directly. You can witness it, like seeing someone hit by a car. You could learn about it, and here this is a little more controversial. So we often in the trauma field would say that we don't expect that people are typically traumatized by turning on the news and hearing about something horrific happening to someone who's quite distant from them, who they don't have any personal relationship with. Usually it requires some kind of personal relationship, and the closer the relationship, the more likely it is to be traumatic. And I think that some of the elements that go into what makes something traumatic is also the unexpected. So all of us in our lives will lose people around us who are close to us to death. People, people close to us will die. But when we get the shocking news that a child or someone we don't expect it to happen to, there's no warning. So even though you didn't witness it, someone calls you and tells you, that can be can induce the same syndrome. So now the question is, what is PTSD? It's the description of the set of symptoms that emerges. And I won't go through each one. I don't want to take all our time with that. But I'll say that the symptoms fall into categories. There are these intrusive symptoms that are things like nightmares, flashbacks, a tendency to be easily triggered, meaning anything that might be reminiscent of the event brings it back. And I like to tell people a way to think about this is that for people with PTSD, remembering is reliving. So the line between things in the past and the present is very hazy. It's when it comes up in dreams or when it comes up in the recollection, the emotions that one experienced when the event was actually occurring comes back, and it persists for more than a month beyond the original event. So most of us have a bad event happen, we feel intensely emotional, and we sort of overcome over time. The pain eases, we heal. And so for PTSD, it's the fact that it seems not to go away, that the dreams continue for months or years beyond the event. There's often avoidance, so because of the intrusive recollections and the pain that goes with it, people will go out of their way not to put themselves in any situation that might possibly bring these memories back. So if you're someone who's been in a car accident that was traumatic and you develop PTSD from the car accident, you might refuse to drive or get in cars or do anything that might bring you back that memory, which could be very debilitating in our society, where people kind of need to get in cars to get around, and where the chances of having another accident are relatively slim, but the person, if they're reminded, feels like it's happening to them all over again, so they just don't want to get anywhere near it. And then there's often other sort of mood related kinds of symptoms, like some dysphoria, some negative mood. And then there's a set of hyperarousal symptoms that come along with PTSD, being jumpy, keyed up, easily startled, irritable. And so this whole syndrome sort of tends to emerge. You don't have to have every single one of the symptoms I mentioned, but often you have a collection of these symptoms that are recognized by psychiatrists as being PTSD. And I think one thing I really want to underscore that is important in the way we normally think about PTSD is it's kind of defined to presume that the event that happened was in the past, and the set of emotions that the person's having in the present are sort of out of proportion with what's happening in the present. So it was perfectly reasonable to feel extremely afraid when one was in the car accident and nearly died. That was healthy and normal to panic and have all those reactions you had. But if you're still having those reactions, 2 years later, every time you look at a car, that is seen as more maladaptive. And how can we help that person to kind of recognize that they're no longer in the car that's nearly crashing?
What I'm struck with is the there may be a maladaptive response, and then there may be a maladaptive response. But if there's a reality to the problem, for instance, I think we talked about in our communications before. How do you heal from something, an event that happens, when it's still a pervasive theme in your life?
Right.
For instance, I don't think it's particularly comfortable for most African Americans to feel safe taking a Sunday drive.
Right.
You know, that there's a real and present danger. Maybe not in every. Maybe not on every highway. I don't know
it's hard to predict.
It's hard to predict.
And where the outcomes are quite serious, like you could lose your life over something like a broken taillight.
Exactly.
So right. So that is something that it's an important and useful distinction to make, because we recognize in the trauma field that there are some classes of trauma that are not at all like car accidents, the example I just gave, but where the trauma is sort of continuous. And I'll just, one example that pops into mind is maybe a domestic violence situation, right? Where the person, has been beaten or terrorized by their spouse, but they're still going to be going home to that spouse. Or community violence, where you live in a neighborhood with dangerous high. You've been in a gang fight, you develop trauma from nearly being killed and whatever, and it could happen again because you still live in that dangerous neighborhood. Mm-hmm. So I think that clinicians approach, when you have this kind of continuous ongoing trauma, one of the clear differences is that the person's symptoms may not be maladaptive, fully maladaptive. They might be exaggerating certain things. But I think the way clinicians tend to approach the second situation is to emphasize helping the person achieve some sense of safety. So for the domestic violence situation, having a plan to escape, making arrangements with friends. If something escalates, how do you get out of the house? In other words, treating the real threat that's there. Mm-hmm. And in the case of race-related violence, it's parents talking to their sons, their male, African-American male sons who are starting to drive cars and maybe listen to, music that might seem like in some ways anti-authority, trying to caution their youth to what can you possibly do to kind of not maybe draw attention to yourselves. If you are pulled over, move slowly, be very deferential to the officer. This is the kind of advice I was given by my parents even years ago, even before these events became televised, which by the way is worth mentioning, that for many who look at this issue, there was a feeling that these events have been going on for a very long time, but have mostly come to our attention because of technology and social media. So it's not like, I would say that social media has really broadcast these events beyond inner city communities like Chicago and New York and Detroit and these other places where it's been ongoing. So I guess what I'm saying is that the ways of dealing with this, your question, how do we deal with it? Some of the wisdom in the community has been to deal with safety, to deal with trying to prevent these kinds of situations, maybe increasing a sense of vigilance or concern to prevent these things from happening, is one sort of approach. I mean, I think that's that's what's different versus when you're working with someone where the trauma is clearly in the rearview mirror. You're trying to help them to combat that sort of inner sense. You're trying to help them with not overreacting to threat. Yeah.
Well, what are the other psychological complications that may result of this kind of chronic stress? And I ask that, for friends, for teachers, for people in helping professionals. What are we missing? Because our experience, or my experience, is so different.
Yeah, good question. And I think this is a bridge from your last question, is because I do want to say that one symptom that's probably more prominent, or I'm calling it a symptom just in a psychiatric sort of framework, but as I'm talking, I'm aware that this phenomenon we're discussing, I think, doesn't fit comfortably within a box of a kind of psychiatric diagnosis. I don't want to place the problem fully in the person, the African American who's exhibiting these emotions is not crazy, and particularly they're not crazy because of this point I'm trying to make. It's not that they are sort of fully overreacting to the real. There's a realistic concern there. It may be exaggerated in some way, so there may be a need to help, but they're responding to something that's happening that we all have to deal with. So that's what's complicated. But the other thing I want to mention is that the syndrome often includes elements that are maybe not seen in classic PTSD, and I think one of the key ones has to do with what has been sometimes referred to as healthy paranoia. And this is something that's been written about in the literature pertaining to African American psychology going back, to the 1960s, that it was observed, over time that non-black clinicians, often white clinicians who would be interacting with African American patients in mental health settings would note a kind of guardedness or suspicion. So you'd have the very well-meaning, clinician or physician who's trying to be helpful, and they notice the patient is, not answering questions in a very direct way. It seems overly guarded. Is asking is not responding the way their other patients respond, and that symptom of paranoia has been a marker of a more serious mental illness, like, say, schizophrenia. And so that would often lead to a kind of misdiagnosis, a tendency to see these African Americans as having a more serious mental health problem, and maybe not recognizing that what they've done is adapting to a world in which they are certain experiences they've had where there's a mistrust. And indeed, these days, healthy paranoia is now referred to as cultural mistrust, which is this kind of assumption that the various institutions that a person's interacting with, an African American person's interacting with, can't be trusted, that there's going to be racism in those institutions, there'll be racial bias. And there's evidence to support this. Some of the bias is subtle, and some of it is unconscious in the people who are committing the bias. And so it's very complicated. But what the mental health professional is seeing is this elevation in paranoia or suspiciousness, and I think what would be missed is to sort of see that there may be something adaptive about that kind of extra question, that assumption that you, the clinician, need to prove yourself innocent. You're guilty first. You need to prove yourself.
I kept thinking of that old expression, as I was reading through these articles, just because you're paranoid doesn't mean they're not after you.
They're not out to get you, exactly.
And that was a interesting phrase to look at it. And you're obviously your parents felt it was important to teach you those skills because of that experience that they knew about, that because of the color of your skin, that there was a greater chance for you to run into that kind of harm, and you needed those skills to work with.
Right, yeah. And the thing with race and with racism in particular is that it raises hypotheses or questions about whether or not you're going to be mistreated, that a person who sort of who isn't the subject of racism doesn't have to deal with. And many times those hypotheses and questions could be excessive and wrong, and the person you're dealing with could be very well intentioned, there could be no harm at all. But the fact is, that the person who is in the group that's sort of has been targeted, it lives by a sort of better safe than sorry principle. Now, at this point, you didn't ask me this question, but I want to throw this into our conversation and see, because as I'm talking about this, you mentioned in my introduction that some of my research has been with police.
Yes, so I'd love to hear more about that.
I just want to talk about the other side of that, because I think that police officers themselves are dealing with a version of this, right? Because I think they themselves are in a profession where there's high risk to them. Every car that they approach to give a speeding ticket to, they have to wonder whether the person in there is armed, whether that person is going to act in some way that might cost the police officer their life.
We have a program at the retreat, a residential program for police officers because of trauma.
That's right. And so since you brought that up, that the nature of the work is one where, just in general, they are operating in an environment where there is elevated risk every time they put on the uniform, every time they do the job. And then some of them will have had experiences on the job that probably give them some PTSD symptoms. So what that means is that some of them are tending to exaggerate or see threat where it's not present. And so you sort of have this interesting mix of the police officer who's vigilant for threat, who's looking, again, I'm talking about the ones who might have some PTSD symptoms. And again, it's probably worth mentioning that part of the culture in many police departments would lead to maybe not openly disclosing. If an officer is struggling a little bit, it's a sort of suck it up kind of culture. If your partner knows that you're having some trouble with your mental health, it means you're not necessarily trusted by your partner who you're working with. So there's a lot of reasons why people might not be fully open about whatever's going on with them, with their mental health, and they may not even be open with themselves about it, because police work is hard work. So I'm just trying to say, you have this police officer situation where some of them are in perfectly good mental health, some are maybe more borderline with regard to their work-related stress injuries, leaving them more vigilant to threat, and then they encounter African Americans, in the field or whatever, who are suspicious of them, highly guarded, highly vigilant, overreacting sometimes to things. And so it could be a very sort of toxic mix of everybody trying to, but of course, in that equation, maybe in many situations, one person's armed, the other one isn't, and we get these kind of results, But I just want to sort of point that dynamic out, just because
That's important.
Because part of me it is very sympathetic to the police officer side of this equation, and I think it's useful because, being a police officer is yet another social identity, and I think now we're getting into a place where officers are claiming that they're being targeted and that we need a Blue Lives Matter movement because and there's some truth emerging to that story too. So it's a very complicated thing, and I don't want to get too far off. But I wanted to create that balance.
Absolutely.
I don't want the viewers to think that I'm only sort of arguing or highlighting the difficulties that African Americans are facing in this story, but it's a more complicated picture.
It's a very complicated picture. One of the phrases that I came upon as I was doing the research for that is the idea of collective trauma.
Yes.
Can you speak to that for a little bit?
Sure. So again, we have this model of trauma that focuses on the individual, the sort of classic car accident example I just gave you. And so sometimes people have a hard time stretching that idea to what does it mean to be collectively traumatized? I mean, so something happens to an African American on a video on YouTube, how does that collectively traumatize? Everyone can easily see if it's your child who was shot at school or something. So everyone can see the fact that person's biologically related to you. We all agree that's a horrifying thing, even though it didn't happen to you, it happened to your child. And so I guess what I'm suggesting is that when it comes to things like race, it's possible that not to the same extent, and I don't think it's usually the same level of emotional, you wouldn't expect the same intensity as one would get from their own biological child. But to the extent that you have a sense that you are connected to your racial group, many cultural groups have a more collective sense of self. It's not just your personal body as yourself. For some people, it's their family unit. They are so connected. They don't make individual choices without considering what their parents would want and grandparents would want. They don't see themselves as individual selves. And I think to some extent, certain cultural groups certainly have a strong sense of racial identity, particularly when that racial group is under threat. And I think African Americans have historically been a group like that. And I think if you want to look for evidence of that, look at voting behavior. Again, there's a lot of variety of human beings. We make very different choices. But if you look at, certainly at the national elections, you see a surprising amount of agreement among African Americans when it comes to political action. We have different views about lots of things, but you get over 70%, sort of checking the same box. Mm-hmm. So it suggests that there's a kind of sense that we're all in it together politically, and our fortunes, we sort of identify this group, this sort of set of priorities is for us, and our group will benefit if we all go in that direction. And so I think when things happen and it seems like it's affecting the Black community, it does feel a little bit like it's Me Too. And if that's true, then you can be to some extent psychologically affected. I'm a little cautious about suggesting that it's the same full syndrome, again, as if you'd been in the car that crashed. But I do think it raises your vigilance. It makes you irritated, frustrated, and certainly changes your sense of belonging in the world, in a world where law enforcement can't be trusted, where you can't feel, if you have a broken taillight, you might be stopped and it can turn into a very difficult situation. All those things are things that we all have to think about.
Dr. Pole, I could ask you a million questions, but we're almost done with our half hour.
Look at that.
And I think what I had, in fact, I had a bunch of stuff I wanted to ask you, but one of the things I wanted to bring back to is something you mentioned to me in our earlier discussions about how, everybody suffers as a result of these things. That we may be suffering unconsciously even, but everybody suffers. So how do we, and this is a big question in the last couple seconds of what we've got left, how do we move this problem in the right direction?
Great question. So I've been thinking about this a lot, and what I would try to say relatively briefly in our limited time is that these incidents make us aware. I started off talking about social identities. I think these race-related injuries have a tendency to separate us. They make us very aware of the ways in which we are different from each other, and people get sort of hunkered down around their racial identities. And I think the path forward is to not to deny that that's true, but to also recognize we do have a common humanity and a common investment in solving this problem, and looking for ways to take collective action. I think it's the only way things have changed. You know, recently I watched the movie Selma and was reminded about the important role of white Americans in moving along social justice for Black Americans in the civil rights movement. So I think there's a role to play for every, so to not get into the place where one feels either that this isn't their problem or feeling like their own group, my group, is being targeted, but to rather say, how can we get together and take some kind of action? And I think the way that this has happened in the past is to push for new legislation, which often tends to change society. It can be kind of a struggle, but, you know, and I'll just put one little idea out there that I've been thinking about is, you know, I think we do need maybe some new laws with regard to the narrow issue of the police matter. I think it seems when these things are tried, the police officers involved usually are able to correctly say under existing law if they felt threatened or, you know, made an error, you know, that the law on their side, they're not intentionally trying to kill anybody. Most of these cases find that it's not an intentional crime. So what we need to do probably is to toughen up the law so that, you know, if an officer even accidentally kills an unarmed person, that probably needs to be criminalized. Now, I'm not suggesting police officers should be heavily punished. You know, I'm not suggesting life in prison. I don't know what the penalty should be. But I think being able to get a conviction, I think there's something about people repeatedly seeing that these things happen and the people involved are found not guilty. It sends a terrible message to society.
Yes.
That there's no criminal action here. There needs to be something.
Well, there has to be some healing from justice.
Something like that. And then once people are able to see that there's a kind of recognition and there's some sort of fair outcome, I think that, so I think as a society, I'm not saying that's the only answer, there may be other answers. And indeed, I do think there are. I think on the police side of the equation, I think that there needs to be better training, particularly around managing threat, PTSD. As someone who's an expert on this, I think we need to do better to support our officers so that they're not so reactive to threat in the field. Maybe more training, more scenarios where they get to kind of, especially, and acknowledging that race is one of those things that people are reacting to, that they see a large Black man in a car and easily sort of misperceive a sudden move, it's a gun. You know, it's hard to figure this stuff out, but I think that's the kind of thing that we need to be doing because it's clearly a social problem. So I think helping officers be more successful because they don't want to be the subject of media scrutiny. They don't want to be suspended. They don't want to have their lives turned upside down. They don't want to be called racist. They don't want that either. So I think we have to figure out how can we all say what we have in common, what we have interests in common in resolving these issues and get together on this kind of stuff. And I think politics is still the best way. We live in a country that permits that. And I think just getting involved in that way would be a really important...
And voting.
And voting. Yeah.
Please
voting.
vote.
Please vote.
Please vote.
Yeah, I honestly think that's really important.
Yes,
right now.
Very much so.
Yeah.
Thank you so much for joining. This has been really, really fascinating to me. And I look forward to spending time with you on December 2nd when you'll be at the retreat doing your workshop.
Yeah, thank you so much again. This has been fun for me to talk about, and I hope this was helpful to the
Very,
audience.
very, very much so. Thank you so much for joining us again for another episode of Keep Talking, a community dialogue about mental health. I want to thank Brattleboro Community Television once again for all the help they give us in putting on this production, and I look forward to spending time with you again.